Two new reports paint a troubling picture of detention facilities for children at the U.S.-Mexico border. One finds the center struggled to address mental health needs of migrant children who had experienced trauma. That conclusion comes from inside the Trump administration. It's a report the Inspector General for Health and Human Services. That report also found that staff were overwhelmed. A second report also released today found that over half the facilities had employees that did not receive a background check before they even started working. For more on this, we're joined by reporter Graham Cates. So, Graham, you've been tracking this. You've been reporting on this topic extensively. What else have you learned from this report, which just came out just a short time ago?
Yeah, the nexus of these two reports is that they're looking at what were the effects of zero tolerance. That was the policy that led to children being separated from their parents when they were apprehended at the border. And what they found was that it caused kind of widespread major effects throughout the system. The first is that the system really wasn't designed to have a lot of younger children. Those are the kids who are most likely to be traveling with parents across the border. And that those kids experienced additional traumas that people weren't necessarily trained or staffed to take care of. So they had more kids with bigger problems, and they had to staff out at the exact same time as they were trying to deal with that influx, which meant that they had less trained staff, often without the proper background checks.
So that means then so I guess my question would be, did HHS provide any solutions to address the trauma that these children were experiencing?
Well, here we are more than a year later, and the Inspector General provided a bunch of recommendations, and HHS gave responses that said either we're beginning to implement those recommendations now, a year later, when zero tolerance is kind of in history, or we're making plans as we speak to come up with stuff. But nothing really has been put in place, except for they described a webinar that would help train people for mental health issues. And one of the really big recommendations was to limit the amount of time that kids remain in custody. And HHS said, we're planning on doing that, but we know from just this past week that HHS is also implementing federal government plans to allow them to be able to indefinitely detain children. So we do have kind of conflicting messages about what's being fixed.
So wait, so one of the solutions that HHS is considering is a webinar?
Yeah, so that's the idea. Like, I mean, there's so many employees that are getting kids that don't have even basic training for how you handle kids in a short-term therapeutic way who have been through immense trauma. So there's first the violence at home, and then there's the secondary trauma of being separated from a family member. And remember, they're still getting separated from aunts and uncles and things like that at the border, even if the parental separation is stopped. And so at the very least, they're saying we're trying to train people in a basic way on short-term therapeutic methods.
And nothing, obviously, being addressed of the children who've already been through the system, who are traumatized and will carry that trauma forever, however long it normally lasts. I'm not a trained professional, but I'm guessing that it's probably going to be significant, those children that were affected by this policy.
Yeah, the reports aren't able to really look at that because, again, I mean, at this point, those kids have gone their separate ways from the system for the most part, we hope. But this is about moving forward, how to deal with another, if it happens, increase in children with these issues.
All right, another report out today found over half the facilities allowed employees to start. They didn't have any background checks. I mean, this is sort of astounding. What are they doing to fix that?
So the first thing about that was that this happened again because there were so many extra kids because of zero tolerance. And the facilities and the staffers were saying it takes a long time to process a background check, but we need more adults around kids. There's there's laws about how many adults to children you have to have when you're taking care of kids. And so the recommendations were like, you need to do more audits of new facilities and facilities that are expanding. And HHS said they're trying to do that now. But it's kind of left open what to do if a rapid expansion continues. And a background check takes a long time to go through. So how to meet that need is kind of left open at this point.
Real quick, in 15 seconds, what's the response from the Trump administration?
They largely concurred with the issues that were identified and the recommendations, but again, their insinuations.
And I mean the White House. I don't mean, I get that this is from the administration, but I mean the White House specifically.
I mean, this just came out, so they haven't actually commented yet.
Do you expect that they will?
I think they're going to leave it to HHS, and HHS is going to say our response is in this report, and if we point out to them the contradiction between the indefinite detainment thing and this thing, the response is typically we don't comment on litigation, which is part of the indefinite detainment issue.
All right, Graham Cates, really astounding report there from the IG. Thank you so much for your reporting. We appreciate it.